Okay, so I'm gonna show you how to treat nosebleeds. You need gloves, you need a gauze pad. Typically you need what's called a BleedCease. A lot of times you may not have one of these, and if you don't have these, then so you just have to use the gauze pads. Let's just say Micah has a nosebleed. First thing I'm gonna do, I'm gonna take this BleedCease out, take it out. Usually they're pretty long, and so for athletes at the high school level, these are good size to be able to pack in the nostril. Little kids, you typically have to cut them in half in order to allow an entire one of these to fit. Otherwise, the majority of it will be sticking out of their nostril, just fall out. This basically will go into the nostril first. Then you'll take your gauze pad out. All of our noses have the nasal bone. So the nasal bone is part of the skull, so it's very hard, firm. It's not pliable, can't be moved. So I'll find his nasal bone. I'll track my fingers down just inferior to his nasal bone, right where the cartilage, it's now soft and pliable. And I'm gonna squeeze, okay? Yeah. And you'll squeeze tight. You'll pinch both sides of his nose so that he can't breathe out of his nose and that blood can't continue to trickle down or even run down both nostrils. It's usually one nostril that is bleeding, it's usually not both. So first thing, I'll look under his nose, I'll find out which nostril he is bleeding from. I'll pack the nostril with the BleedCease. We'll pack it so much to where you barely can see the end of the supply. Then after it's packed, I'll take my gauze pad and I'm gonna use these two fingers to pinch. And I'm gonna use my ring finger to hold the gauze pad underneath his nose. So it's gonna look like that. So this feels great, dude. Okay, and then I'm gonna pinch, hold underneath with one finger, and I'm gonna lean his head forward. All right, so we're gonna hold this for 5 minutes. After 5 minutes, I'm gonna pick his head up. Usually what I'll do is I'll take my other hand and I'll look underneath and I'll see if that BleedCease has absorbed a lot of blood. The entire BleedCease is absorbed with blood. So at that point, I'll remove it. Oh my God, that's so gross. So then I'll fold it and I'll put another one in. And then I will pinch again, like so. And hold, and then hold down for another 5 minutes. Then, after that, I will look under his nostril like so. And usually after a second one, we should see the majority of it is still white. And if that's the case, that's fine. We'll remove it. We'll use some wipes, clean them up. Clean the hands up. And then use another gauze pad to dry them up. All the saline wipe that's wet, we'll just use it to dry them up, dry out his hands, and then we'll return them to the field. Now, it might only be one BleedCease that you need. So you may put one in, and then when you remove it, it's just a little red. That's all. So you don't need to put a second one in because you've stopped the bleeding already. Then you'll clean them up. Always head forward. So most of the time, if the second one comes out, usually it's fine. But there are times when you pull the second one out and it's red and you got to put a third one in. So it just depends. After that's done, I usually have my sanitary person. I give her all the stuff, right? So that, okay. Then she'll crumple it as much as you can. Got it? Then she's going to So keep crumpling it. She keeps crumpling it. And then we'll put it inside that glove, like so. And we'll take this, we'll scoop, and everything goes inside the glove. Then I take it from my helper, right? And then I toss it away, or a trash can for her, and then she drops it. All right? Okay? All right? Right? Okay? Now, so what you thank you, Jalissa. You're amazing.
10 out of 10 acting.
Right? So that's how you treat a nosebleed. So that's how you treat a nosebleed. Thank you, Micah.
Yeah, thank you.